if you would just try harder. You have so much potential. If you can focus on that video game, you can focus on this assignment. You're making this harder than it has to be. You're just being lazy. Stop being difficult. These are all statements that tear at a girl's self-esteem when she goes undiagnosed with ADHD. She isn't lazy. She can't just focus more. And she really is trying. If you're a parent, a teacher, or a medical professional, then this matters to you. It also matters if you just have a young girl in your life. Learning more is helpful. My own daughter was called difficult and lazy several times. Her teachers from school would email or call regularly. Her self-esteem was low, and she even got to a point where she was calling herself dumb and stupid. It hurt my heart, and I knew that there was more to it than her just being difficult or lazy. So after some research and finding a wonderful developmental pediatrician, I now know that my daughter has inattentive type ADHD. Girls are disproportionately diagnosed with ADHD than their male counterparts. According to understood.org, boys are 3 times more likely to be diagnosed with ADHD than girls. And they're diagnosed far earlier than girls, allowing more time for treatment and support. This is because ADHD has a tendency to present differently in girls than in boys. Today, that's what I want to discuss. How ADHD impacts girls differently and what we can learn from it. We'll discuss the 3 types of ADHD, how it presents differently in boys and girls, the research and the screenings and how those lean heavily towards boys with ADHD, and we'll talk about why going undiagnosed matters to girls. So let's start by defining what ADHD is. The American Psychiatric Association defines ADHD, attention deficit hyperactivity disorder, as a pattern of behavior present in multiple situations, like school and at home, that can result in performance in social, educational, or work settings. Individuals diagnosed with ADHD fall into one of 3 types. The first is the most commonly known predominantly hyperactive type. The second is the lesser known, predominantly inattentive type, and the third is combination type. The first type, hyperactive type, is what is commonly pictured when you hear ADHD. The Diagnostic and Statistical Manual of Mental Disorders, or DSM, lists the criteria for mental disorders, and in it, for the characteristics of hyperactive type ADHD, it lists behaviors like acting as if driven by a motor, constantly on the go, interrupting, trouble waiting turns, impatient, leaving your seat when staying seated is expected. The second type, which is inattentive type, is the lesser known. Behaviors listed in the DSM for this category are more internal than external. And this lists things like fails to give close attention to the details, careless mistakes on schoolwork and homework, often doesn't focus or follow through, gets sidetracked easily, often avoids, dislikes, or is reluctant to do tasks that require mental effort over an extended period of time, like homework or housework, often loses things necessary for tasks, and is often forgetful in daily activities. The third type, combination type, has characteristics and behaviors of hyperactive and inattentive type. So as you see, 2 of those 3 types list hyperactivity. And even the name of the disorder itself, attention deficit hyperactivity disorder. It makes it all seem like everyone affected by this disorder has symptoms of hyperactivity, which isn't the case. And it makes it that much harder to take notice of those without it. Boys are far more likely to be diagnosed with hyperactive type or combined type, while girls are more likely to be diagnosed with inattentive type. In school, teachers are more likely to notice the boy who can't sit still, who won't stop fidgeting, and can't keep their hands to themselves. These are all classic signs of hyperactive type ADHD. Teachers are not going to notice as much the girl that can't finish her math assignment because she gets distracted or is disorganized or can't pay close enough attention to the instructions. At home, parents are more likely to notice behavior of the boy when it affects others, like the constant running, physical aggressions like hitting, or excessive talking. Parents are less likely to notice the behavior of a daydreaming daughter with a messy and disorganized room. But those are also symptoms of inattentive type ADHD and can be problematic for girls. Dr. Patricia Quinn, the director and co-founder of the National Resource Center for Girls and Women with ADHD, put it this way: politely daydreaming underachievers just don't attract attention in the same way as hyperactive and impulsive little boys. Staring out the window daydreaming is nothing when the boy next to you is dancing on the windowsill. It isn't just teachers and parents, though, that have difficulty identifying girls with ADHD. Even medical professionals leave girls out. Dr. Kathleen Nadeau, Director of Psychological Services of Maryland, states that historically, research for ADHD has focused on little boys. Only in the past 6 to 7 years has research started on adults with ADHD, and research on females specifically lags even further behind. Because of this lack of research, this has caused the screenings and development for those for ADHD to be heavily focused on how the disorder affects boys. A study in the Psychiatric Times found that the wording of DSM criteria heavily focuses on the manifestation of ADHD in boys. That study also finds that the screenings have a tendency to help boys become diagnosed, but hinder girls from being diagnosed. And they suggested in this study that the screenings done by parents and teachers hold less weight than self-screenings, because parents and teachers hold more significance in the hyperactive symptoms of ADHD, whereas self-screenings are more likely to show the internal struggles that inattentive type symptoms cause. When girls go undiagnosed, they struggle, and they struggle in ways that you might not expect. Boys are with ADHD typically externalize frustrations, whereas girls with ADHD tend to turn their pain and anger inward. Girls with undiagnosed ADHD, according to the Chesapeake Psychological Services of Maryland, run a risk for chronic low self-esteem, underachievement, anxiety, depression, teen pregnancy, early smoking, and as adults, they continue on, if they're undiagnosed, at a higher risk for divorce, financial crisis, single parenting, never completing college, underemployment, substance abuse, eating disorders, and constant stress due to the difficulty of managing the demands of everyday life. Neuropsychologist Dr. Michelle Klonsky describes that challenge of meeting the demands of everyday life as running life's race with lead weights on your ankles. Remember, there are 3 types of ADHD: hyperactive, inattentive, and combination. This disorder presents differently in girls and boys, and the screenings focus on that. When undiagnosed, girls have a tendency to have higher risk of other mental health struggles. Instead of saying lazy, spacey, and disorganized, we are better informed to know how this disorder affects girls. And knowing will help them get the support and the things that they need so that they can succeed in life. Thank you.